Heart Month is here and a time to raise awareness about cardiovascular disease. An important part of this topic is prevention. Dr. Samuel MORTOTI, cardiologist with OSF Healthcare Cardiovascular Institute, joins us now with some tips to improve your heart health. Good morning. Thank you for joining us, Doctor.
Good morning, Kamia. Thanks for having me.
Of course. So starting off, what major lifestyle or behavioral changes can we all make to do better for our heart health?
Yeah, the main behavioral lifestyle changes we can make to improve our heart health is let's move more, let's exercise, let's eat right. So let's watch what we eat, healthy foods. If you smoke, you want to quit smoking, and you want to have healthy sleeping lifestyle. So sleep hygiene is very, very important too.
I see. Okay, so what are some key health factors to kind of discuss when it comes to heart health?
Yeah, so with regard to heart health, the important health factors are see your doctor if you have high blood pressure. They check your blood pressure. If it's high, they put you on the right treatment. And also you have to institute some lifestyle changes to help, reduce your blood pressure, which we're going to talk about. Also, if you have to go see your doctors, get checked for diabetes. And if it is high, you get treated for diabetes and also supported with lifestyle changes. You want to get checked for cholesterol. So it's very important to talk about cholesterol because cholesterol is produced by the body and also by the food that we take in, and therefore we can institute certain lifestyle changes in terms of our diet, exercise, etc., to control our cholesterol levels. And also, like we said, it's very important to get checked and also to institute weight management. Weight management is very important, it's an epidemic in our population with obesity. So weight management is key. You want to keep your BMI, even though that is not a perfect index, but that's what we have. You want to keep your BMI below 25. And how can you do that? It will involve exercise. It will involve, dietary discretion. You want to watch your diet, count your calories, read the labels of the foods that you eat so you can take all that into consideration. Quit smoking, all that will help, and exercise too.
Okay, so are there any major concerns you have about Americans specifically? I know you mentioned obesity and how it's an issue right now. How about people in our country? What can they do to kind of increase their heart health?
Yeah, heart disease is the #1 cause of death in this country. And think about it this way. According to data released by American Heart Association in 2023, every 34 seconds somebody is dying from heart disease or cardiovascular disease. So that is very profound. Even though we've made progress in decreasing overall cardiovascular death risk, it's still the #1 cause of death, and we still have more work to do in this regard. If you think about it, the prevalence of heart disease is also very high in this country. About half of the U.S. adult population has some kind of cardiovascular disease. 47.3% of adults in this country have hypertension. So it's very, very important for us to talk about these things, and these are concerning statistics.
Well, thank you so much for that information, and thank you for joining us this morning, Doctor. It was very helpful, the insightful information that you gave us. Well, you could watch this interview on our website, 25newsnow.com, and we'll have more news after the break.